Hi everyone, and welcome to today's conversation. Today with us is Dr. Otto, Niki and Dr. Chris from Physicians Weight Control and Wellness. What we hope to achieve today during our conversation is maybe dispel some myths from the weight loss and nutritional world, and hopefully impart some information to you that you'll find beneficial and useful. So my first question is, I guess, the weight loss and nutrition industry is just simply massive. There are so many contradictory ideas and notions out there, and I'm sure for anybody that wants to act on losing weight or adjusting their lifestyle or accustoming their diet must be simply overwhelmed by contrary information, new fad diets, new methods of losing weight. Can we maybe offer them some factual information as a basis for them to grow their ideas on? So what's your opinion of this, Chris?
Well, I think maybe to simplify it, you would have to maybe divide it into two categories: the weight loss industry and medical treatment, or medical treatment of weight management or obesity. And so those are two separate things. The weight loss industry is where a lot of the confusion is. And unfortunately, even on the medical side of it, there is some confusion just because there's so many different factors and physiology and anatomy and genetics and everything else that come into play with managing weight. So
I guess from a surgery point of view, we're talking about what particularly? We're talking about obesity that has got to a certain stage where their health will drastically deteriorate unless they have some form of surgery.
Yes, that's actually changed over the last 10 or 15 years, the qualifications for insurance coverage for these surgeries. And of course, there's been several types of surgeries that have been developed over time. When it first came to the point where insurance was okaying those surgeries and covering those for people, the qualifications to obtain that reimbursement weren't very difficult. So a lot of people were getting the surgeries. Over time, that's changed. The insurance has become a little bit more difficult. There's a little bit more qualification as far as health issues and how much overweight you are. Those qualifications have changed. So there's not quite as many people getting those surgeries. The interesting thing is, now that we've been 10 or 15 years out where we really had a good number of surgeries, we're finding that a large percentage of those patients, unfortunately, are starting to gain their weight back. So this really brings it all into perspective, that by focusing on one aspect of obesity, where the surgery is focusing on changing the anatomy of the gut so that you can only eat a little bit, while initially it helped you lose weight, in the long run it doesn't treat the whole problem.
Because nobody's changing how they eat.
Exactly. And so, I have several patients who come into the clinic who've had surgery in the past, and they have started to gain their weight back. And one of the questions I like to ask them, because it really tells a lot about what's going on, is I ask them, did you ever lose your hunger? And the standard answer is, I was hungry when I came out of the OR. So they never lose that drive or that urge or those cravings and all that, but there's a certain limit that they can eat, and that's where the success happens after the surgery.
So, Dr. Otto, obviously Physicians Weight Control and Wellness Centre isn't a surgery-based medical practice, but it is a physician's monitored weight loss program. What does that mean?
Well, it really means several things. I like to use the word comprehensive. Every person that comes in to our clinic is special. They are treated that way. We know they've been through it. As we look through their history, we see time after time multiple attempts at losing weight. The first thing we have to be sure that they know is that we're not going to get you 100 pounds off, 200 pounds off, whatever it might be. We don't think you need to weigh to 115 pounds or 125 pounds, because in medicine's day, it has been proven and shown, and everybody agrees, 5 to 10% weight loss is enough for most people to be able to handle the obesity-driven diseases. For some people, they can go off their medications. For some, they can reduce the dose. For instance, for diabetes, high blood pressure, osteoporosis, you name it. I don't have to go down the list. You know all those things. Not to downplay the depression that goes in, the depression and the anxiety that goes with carrying this weight around. So these are special people, and we treat them that way. We visit with them face to face. We talk to them in ways and methods that they feel good about it. And when we announce to them, look, you only have to lose 10 pounds. If it's a 5 to 10% weight loss, and you lose your 200 pounds and you lose 10 pounds to 190, now I will say we can go farther than that pretty easily, but just that much of a weight loss is absolutely critical. And so when they come in, they're cheered for any progress. As we review everything with them, we try to fit the program to the patient. We have different ethnic groups, all different kinds of medical problems, and we try to work on that. So our goal is to make people healthier with 5 to 10% weight loss. If we get 15, 20, 30% weight loss, all the better.
Okay, so what kind of role does nutrition play in all of this?
Nutrition is, the way I see it, is more of a, is more of a stepping stone, helping to guide them into better food choices, because you can lose weight by just eating less, but you really truly want to eat healthier. People can say, well, I just need 1,500 calories. Well, if those 1,500 calories are all processed foods, you're not going to see as much of a reduction as you might see in eating a salad or eating healthier portions of your fish or your chicken. It's more of a...
So you're actually talking about a transition from sort of like processed carbohydrates and sugars,
Yes.
into natural foods,
Yes.
that provide the same level of calories, the same calorific intake, but obviously one is very healthy for you and the other one isn't.
No, it's not, and it'll actually help with the conditions that Dr. Otto was talking about. They're all inflammation-based diseases. So if you're taking out things that are inflaming your body and causing your body to gain your weight, you're gonna naturally reduce that. And so my focus always is on natural plant-based foods and being able to help guide people into making healthier choices for their own needs. And I'm all about accessible nutrition. You make it easy, and people can do it. Because people look at the health industry and they get overwhelmed. They don't want to do it because they don't know where to start. And so that's my whole goal in trying to take the mystery out of the health food industry and helping guide them into a healthier lifestyle, I guess.
Foods can either be a poison or a medicine, depending on which foods you're eating. And the interesting thing about that is it can actually be an individual response. Some people are much more sensitive to carbohydrates and sugar, and actually it starts a destructive process in their health more than others. So genetics play a part of this too. There are so many different facets, nutrition, genetics, environment, and other things. But inflammation is really a underlying theme to a lot of it. And so if we're eating the wrong foods, we're kind of poisoning ourselves. If we change and eat the right things, we actually are giving ourselves a medicine to cure that.
Also, I read an article in a journal not too long ago about the addictive nature of some of the ingredients, certainly that go into processed food, but are actually included in almost everything that we eat that isn't natural food product.
Yes, addiction to sugar and refined carbohydrates, it really is the same thing when you look, when your body breaks it all down. But that addiction is a very real thing. They've been able to prove this through brain imaging studies using MRIs and other modes. And what happens is the pleasure center of the brain lights up on the MRI as if you were smoking a cigarette with nicotine or cocaine or alcohol, any of these other things that are addicting. So it's really been an eye-opener in the treatment.
Just there a second. What you're actually saying now is that this old theory that seems to scaffold the whole weight loss industry up, which is eat less, do more, doesn't work.
It doesn't in the long term. You know, when I mentioned the divide between medical treatment of obesity and overweight and management of weight, and the health food industry, or I don't want to even put them in a bad light, but the weight loss industry, that side of it tends to focus on short-term success. So you may go into a program where they're telling you what to eat, or they are selling you foods that have been engineered, while the nutrition might be good, and there may be some lower calorie. But everybody has their own program, and what their goal is for a short-term loss. And then once a client or a patient has reached their goal, then what? So
It doesn't teach them anything.
It doesn't teach them anything. You're exactly right. So the medical management needs to be as if we're managing a lifetime disease, because if we're talking about addiction in any other manner, whether it's illicit drugs or smoking or alcohol, that is a lifetime management.
Yeah.
And unfortunately, many of those folks will have relapses along the way, and it's just part of the process. And what you have to do is pick yourself back up and get back to the abstinence again. So the difficult part of managing the addiction to the sugar, the flour, the processed carbohydrates, all these things, the difficulty in managing that for your life is that, well, drive down the street and look at all the signs of the fast food places and the restaurants. Yep. We all like to go on vacation and sit on the beach and have a drink here and there with a little sugar in it, and we celebrate our birthdays. And so, you know, this is a lifetime management of an addiction that's always there. It's always present. Yeah. And that's the difficulty of it.
Okay, so this question will be probably better addressed to you, Dr. Otto. How do you initially break that addictive cycle?
Well, you will have withdrawal, just like with any other addictive cycle. Sugar, we had the trans fats, real big problem. We had the corn fructose, very bad, and they were in everything, and the corn fructose still is. But it's hard to break an addiction to sugar when the prepared foods all have sugar.
Of course, yeah.
They all do. They all have sugar. We're talking about a lifetime. Chris mentioned a lifetime. That's what we try. That's what we try to do. Even if a patient gets away from us and say they've lost 40 pounds, we want them to know every time they come in, we're going to maintain this weight loss. We're going to maintain it. And when they slip, come back, please. Even if you gain 10 pounds, we want you back. We're your friend. Well, I just delight in seeing patients buy into that. And I hate to use that word. I shouldn't use that word. But I just love to see the patients when the light bulb goes on.
Yeah.
And they feel good about coming in to see Dr. Chris because they know he's not going to tear them down. And so it's just really a wonderful situation. We do go long term. There's no question about it. I can go in the office and see people I've seen 30 years ago. Treated 30, and there they are at my age, doing well, very healthy. Do you know how much good we can do for people with the diseases? Is obesity a disease? You answer that.
Yeah.
It is, and it's got a hold of them. Is any kind of addictive disorder a disease? Yes. Ask the addicted person. They'll tell you, I've got a disease. So we try to offer things that you can't get other places. And that's a total comprehensive weight loss program that suits you and gets results. And that's what we're into. I'm sure we'll go into some other things that I think are important to see that we do this. But I invite anybody within the area of my voice to please search this website, look at it, search it, look at what we have to offer, and give us a chance. And as we go on, I think we'll probably be able to sell you, so look for us next time.
Yeah, absolutely.